Assalamu alaikum. I am Dr. Sagia Afrose, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Today I am going to discuss about the antipsychotic drugs. Before going to drug, I am going to tell about the depression. What is the definition of depression? Depression is a kind of mood disorder that is characterized by feeling of intense sadness and despair, mental slowing and loss of concentration, pessimistic worry, lack of pleasure and variable agitation and hostility. And some physical changes occurs in severe depression such as insomnia or hypersomnia, altered eating pattern with anorexia and weight loss or overeating and weight gain, loss of energy and libido, disruption of the normal circadian rhythm of activity, body temperature and many endocrine functions. Now, what is the monoamine hypothesis of depression? In depression, there is a deficit in function or amount of the monoamines such as amine neurotransmitter, noradrenaline and serotonin in the brain, which stands central of the biology of the depression. Now, the classifications of antidepressant drugs. There are two types of antidepressant drugs, one is typical and another is atypical. Typical drugs are categorized into first generation drug and second generation drug. Typical first generation drugs are tricyclic antidepressant drug, amitriptyline, nortriptyline, protriptyline, imipramine, clomipramine, diazepam. Second generation drugs, selective serotonin reuptake inhibitors or SSRI, that is fluoxetine, paroxetine, fluvoxamine, citalopram, escitalopram, sertraline, etc. The serotonin noradrenaline reuptake inhibitors or SNRIs, that is venlafaxine and duloxetine. MAO inhibitors, non-selective irreversible MAO inhibitors are phenelgine and tranylcypromide. The selective and reversible MAO-A inhibitors are moclobemide and selective and irreversible MAO-B inhibitors are selegiline and rasagiline. Newer atypical drugs, 5-HT2A antagonist, trazodone, nafazodone and tricyclic and unicyclic antidepressant drug like amoxapine, bupropion, meprotilene and mitrazepine. Mechanism of action of tricyclic antidepressant drug. Inhibition of the neurotransmitter reuptake. Tricyclic antidepressants are potent inhibitor of the neuronal reuptake of the norepinephrine and serotonin into the presynaptic nerve terminal. Blocking the receptors, it also blocks the serotonergic 5-HT, alpha adrenergic, muscarinic and H1 receptors. Therapeutic uses of the tricyclic antidepressant drug. It is used for treatment of the moderate to severe depression, panic disorder, nocturnal enuresis in case of children older than 6 years, attention deficit hyperactivity disorder or ADHD, prevention of the migraine headache, premature ejaculation, pruritus and treatment of insomnia. Panic disorder, pain disorder like chronic pain, neuropathic pain, diabetic neuropathy, trigeminal neuralgia, post-herpetic neuralgia, etc. Now, what are the adverse effects of tricyclic antidepressant drugs? By blockage of the muscarinic receptor leads to blurring of vision, dry eye, dry mouth, urinary retention, constipation, sinus tachycardia, aggravation of the angle closure glaucoma and overdose may causes the life-threatening cardiac arrhythmia. Blocking of the alpha adrenergic receptor may cause orthostatic hypotension, reflex tachycardia, dizziness. Blockage of the H1 receptor may causes sedation. Weight gain, incidence of the sexual dysfunction and withdrawal syndromes are also adverse effects of this drug. Therapeutic index of tricyclic antidepressant drug is very narrow. It exacerbates the certain medical condition like psychosis, epilepsy or seizure, benign prostatic hyperplasia, pre-existing arrhythmia and angle closure glaucoma. Now, the mechanism of action of SSRI or selective serotonin reuptake inhibitors. These drugs selectively inhibit the reuptake of the serotonin. SSRI have little blocking action at muscarinic, alpha adrenergic and histaminic H1 receptor. So, the common side effects associated with the tricyclic antidepressants are not commonly shown with the SSRI. They are relatively safe even in overdose. The therapeutic uses of the SSRIs are depression, anxiety disorder, obsessive compulsive disorder, generalized anxiety disorder, social anxiety disorder, panic disorder, post-traumatic stress disorder, premenstrual dysphoric disorder, compulsive buying, kleptomania. Eating disorder like bulimia nervosa, anorexia nervosa and sometimes used to treat the premature ejaculation. SSRIs are first choice of drug for generalized anxiety disorder, obsessive compulsive disorder, panic disorder, social phobia, eating disorder, compulsive buying, kleptomania, premature ejaculation. Now, what are the adverse effects of SSRI? SSRI can cause headache, sweating, agitation, GIT effects like nausea, vomiting, diarrhea, abdominal cramp, changes in the weight like weight loss, weakness, fatigue, diminished the sexual function and interest. It may cause loss of libido, delayed ejaculation, delayed orgasm, diminished arousal and more pronounced than the tricyclic antidepressant drug. Sleep disturbance like insomnia may associated with these types of drug and it is associated with the hyponatremia in elderly patients. In pregnancy, most of the antidepressant drugs are category C and paroxetine may causes the cardiac septal defect in first trimester of the pregnancy and it causes the teratogenic effect. Now, what are the advantages of the SSRI? SSRI has no first pass metabolism, so it is absorbed orally more and bioavailability is more, long half life and long duration of action, so less frequency of administration. Blockage only 5-HT receptor more selectively, so muscarinic receptor blocking effects are less, no alpha adrenergic receptor blocking effects, no histaminic receptor blocking effects, no cardiotoxic effect, no cardiac arrhythmia, no sedation, no weight gain and no cardiotoxic effects. Now, atypical antidepressant drug. Moclobemide, bupropion and mitrazepine. Mitrazepine blocks the alpha-2 autoreceptors on the norepinephrine neurons and alpha-2 heteroreceptor in the 5-HT neurons, thus it enhancing the norepinephrine and 5-HT release and antidepressant 5-HT1 receptor activity is achieved by the concurrent blockage of the 5-HT2 and 5-HT3 receptors. It markedly sedating because of its potent antihistaminic activity, but does not causes the antimuscarinic adverse effects like tricyclic antidepressant and it do not interfere with the sexual function like SSRI. Uses mild to severe depression and it is suitable for depressed patient having insomnia. What are the adverse effects of mitrazepine? It increase appetite, weight gain and sedation. That's all for today. Thank you so much for your patience hearing.